Hello people, if you're new to my channel, my name is Dr. Shabaz Ansari and as of now I'm working as an acute care clinical fellow in the North Wales. First of all, I would like to congratulate everyone who managed to clear their PLAB 2 and succeeded in getting the GMC registration. And the next step is applying for your jobs. So in this video, I'm going to be telling you about how to apply for your jobs in the NHS via using NHS jobs. I'm just going to walk you through about how to register yourself, how to find an appropriate job which is suitable for you, as well as the tips and tricks and the ins and out of writing about yourself and making sure your CV, your resume gets selected for an interview. So that's about it, and just a bit pretext about myself and how my journey was. I cleared my PLAB 2 in April of this year 2021, and I managed to get an interview by maybe June. So it took me around 1 to 2 months to apply for the jobs and secure an interview, and hopefully, alhamdulillah, I was able to secure a job, and I started working by September 29th of this year. So that's about it. Let me just get into the video right now.
So you go on Google, type NHS jobs, which is already typed. This is the profile. You click it, and this is a register. So first of all, what you do is you register your everything: first name, surname, country of residence, email, and everything. And you'll be able to make a profile there. And since I've already made my profile, so I'm just going to log into my profile. So that is my profile, and this is the main view. So first of all, how will you be searching for your jobs? So this is the keyword or the job references that you can put. The keywords will be entered into the description box below. You'll be able to see them. And the job description what I be searching is for senior house officer or trust grade doctor. So these are all the posts that come on the page. Let me just go and click on senior house officer urology fellow. So the tip that I would like to give you here is you should always sort it out by the date posted latest. It means that the job which is posted here will be the first one, and if you scroll down, for example, this job, senior house officer in the emergency medicine, this has been posted on 26/6/2021, and the closing date will be 30/11/2021. So the bottom that you go are the applications which will close the earlier, and you'll get an earlier response. So you just go on it, click on this. And this is what the page comes in. Here you can find out all the job description, everything. Where is it? What will you be expecting? What are the requirements of the job to be applied for? So this is the job, and what you do is, and in order to get a bit better experience, you can also go on this job description, which is mentioned here, and it'll take you to another folder which will tell you about the actual description of the jobs, what is the expected things that you are supposed to do during this job of yours, what will be the add-ons and allowances will be given to you. Basically everything and anything that you need to know about this job. Okay, so what you need to do after that, and if you have got any further question, you can always email the concerned person, which is the representative for this job, or the consultant who is responsible to allocate the doctor. So you can email him or her. So after that, so this is how you search for the job, and if you see here apply for this job, you can see this link here and you can directly apply for this job. Okay, but first of all, I would like to go and add on your profile. So if you go to the my jobs profile, my NHS jobs, you'll find my profile. Okay, and you'll click there. So basically this gives you, it takes you to this page where you'll be given to make a pre-added and pre-made profile, so you can apply for any job you like. Okay, let me just walk you through, then I'll be sharing how to apply for the job. Okay, so the first column is personal information. So you'll be writing everything, that your name, your surname, your home address, where you belong from, your contact details, and blah blah, everything. Okay, and what is your visa status, what preferred job employment are you looking for. If once it's done, you just save and continue. So it will take you to the other. So this one is qualification. Here you'll be writing everything, what have you done so far. So I done PLAB 1, PLAB 2, OET, FCPS part 1, MBBS, intermediate matriculation. After that, the courses that I have done, BLS, whatever courses and online trainings that you have done, which you can justify, you can write them here. So I've done BLS, time to teach internationally, threshold concept, ALS, BLS in Pakistan, ultrasound courses. Then do you please indicate your professional status. So here you'll be telling that whether you have gotten the GMC, whether you've cleared your PLAB 2, whatever that is. After that, the professional body of membership. So this is basically the professional body of membership is, if you have a GMC license, you'll be adding this here, that I am registered and licensed. They'll ask you your membership number, which is 77, whatever that is, and the renewal date. Once it's done, you save, continue. So yeah, so these are the applications that you can make in your spare time, and once you apply for the jobs, you can actually pre-add them and load the earlier application already. So the next thing will be the employment history. So in the employment history, they'll be asking you everything. Where have you worked? What was the hospital address? What was the type of the job? Who was your clinical supervisor there? A contact, what was your post, what was the specialty, what was your grade, everything. What was the type of contract, if you had left the job, what was the reason. And after that, well, this is the important part in this one, is a brief description of duties and responsibilities that you took undergoing that job. Okay, so that can vary from job to job and place to place. If you were placed in a clinical status job, if you're placed in ICU, if you were placed in an OT, if you were placed in wards, whatever that is. So here I just wrote my experience as a resident medical officer. I rotated from COVID ICU and medical surgical wards, and gave them pinpoint details of what have I done, what duties was I given, how much successful I was, what were the procedures I did, and everything and anything that you can describe, which will specify your experiences that you gained during that particular job. So after that, you have to go in the chronological order, starting from the latest, going back to time. Then I did a job in the rural health center. That's the address. It was a locum job, specialty medical and surgery, and the reason I left the job, and the experiences that I gained, and the things that I did during that job. Yeah, I tried to write it in detail. Then my surgical residency that I did in Jeddah, the details of it, my supervisor's name, his contact, how much I did the job, reason of leaving, and what were the experiences that I gained during my surgical residency. What were the operations that I assisted, what procedures did I did, what daily duties I had, so everything. And this goes on and on. Yeah, and after that, my internship details, my 6 months medical and 6 months surgery details. Okay, and once this is done, so basically this is everything that you have done during the time that you worked there. After that, they will ask you any employment gaps. So basically here you have to justify any employment gaps that you have had in your career. Like for example, I had a gap from January 2019 to April 2019 where I had to get my documentation done and get the license to practice in my country. In May 2019, I sat in my postgraduate exam. Meanwhile, from Jan 2021, I came to the UK for my PLAB and stayed till April. So that's the reason of my gap, and it's justified. And then it comes to the referees. So coming to the referees, I advise you to contact the contact person that you're willing to add a certain somebody into the referee, and make sure that they have a email address which is in use, because once you are selected for a job and the interview is done, your HR, there's a mandatory clause that your HR has to contact your referees in order to make sure whatever you have written is actually the right thing, and you have actually worked under that doctor's name that you have mentioned in the referee. And yeah, they will ask them basically, how was your performance, is there anything you need to be careful about, or any complaints whatsoever. So you have to at least add 3 referees. So make sure you ask the particular doctor that you can put their name as a referee, and it's not necessary that you have to add only the doctors you've worked under. It can be a friend, a family member, a landlord, but it's advisable to write your previous employer under which you have worked. Okay, then you have to save and continue. And then this is by far the most important part of the profile. So here you have to write the procedures that you've done. I've done IV accumulation, blood sampling, ABGs, urinary urethral catheterization, aseptic dressing, paracentesis, blood transfusion, and NG tube insertion. Well, and the amount of time I needed supervision, and then I did independently. So this is basically, these things change from job to job. For example, if it was a medical job, I would write paracentesis, thoracocentesis, and all the medical needed procedures. And if it was a surgical job, I would like to write suturing, wound management, and you know the rest. So then I would have to describe how much clinical efficiency do I have upon these skills, and if I needed any help in a certain skill that I have performed but I'm not confident enough. And after that, you'll have to describe your teaching, because a lot of jobs actually require a teaching capability and ability, because you may have to teach your FY1s or medical students, other people. So you'll have to write, have you done it? If yes, then you'll have to provide the details of the teaching session. Do you have any particular qualifications in teaching? A lot of people have bachelor's in teaching and other small degrees or diplomas. So you have to write that. Then comes to any change that you have done or managed to conquer during your education or practical work life. So I used to work in an NGO. So we are NGO supervised renovation of surgical ICU. So that was done in this date for the better care of patients. And what was the conclusion? How did it change the outcome? And what impact was on your team members and other people? Then it will ask you about the research. So if you have done it, you say yes, then you'll have to give the details of it. So I did a couple, maybe 2 researches. I just mentioned one here because I'm not really confident to mention my research, because I don't have the command over it. Because a lot of jobs actually are research clinical fellows, where the research is the main thing and the clinic is a secondary thing. So I did a research on risk factors associated with surgical site infections done in this date. Aim was to discover the risks and what was the conclusion. After that, you'll have to summarize of any audits that you've done, any particular degrees that you have in research, then the other research publication, the name, the journal it was published, the authors. Then I had done one more research, So there its details. Then any presentations that you have done, if yes, you have to give the details. So I was able to do only 2 presentations because I don't have a lot of certificates to justify them. So I just do not write what I cannot justify or um, give any proof if I didn't have any. So I did a lot of presentations, but I did only had proof for 2 or 3 of them. And this is a very crude NHS profile. It's not updated. So yeah. So the prices, if you have won an academically, I did not raise any prizes. So I said no. If you have won any prizes, you can say yes, and it will ask you about the detail and about the awarding body and the year you received. I didn't receive any, so I would say no. Okay. After that, it would ask you the management and leadership experiences that you might have done during your med school or during pre-med school or during the job. So I had written about my NGO experience, how we used to work. At times I had to deal a lot of management issues, and I had to be a leader of the team or stuff like that. So I've written that, and everyone in the workspace at times has to show leadership qualities when you're supervising a patient, when you are managing an ALS, when you are actually the senior and you have to manage a lot of juniors. So yeah, you can sell your experiences here. And after that, team working, you have to basically tell about how good of a team player you are, how you have helped other team members in their problems, what were the things that required you to solve them, or what were the issues. So, and that's about it. You may have you might have better experiences than me and better words, so just give it a go and do not shy away from writing about the good qualities that you have. Okay. And after that, the supporting information. So the supporting information basically is the things that you have not mentioned in the whole profile and you want to add them. So basically this is the area where you can sell yourself on how much of a good person you are, how much of a good doctor you are in the hospital, and how you call it, what are the qualities that you have, what are the things that you have done, what are the things that you want to improve, and what are your future goals, how your addition in their facility would be a benefit to them, and how it's going to be very good for you and your improvement in the skills. So yeah, just this is like a canvas and you can paint whatever you want to like, and just don't shy away from using the words because you get approximately 1200 to 1500 words. So I'm still short on approximately 500 words because I'm not much of a good writer. So yeah, this is where the place where you can have wildness of your imagination and just sell yourself and advertise as much as you possibly can. Okay, and then save and continue this, and after that you'll be taken to this page. So this is the monitoring information. They'll ask you if you have what is your ethnicity, what is your date of birth, what is your sexual preference. I don't know why that matters. Have you committed any crime or something of the like that? And do you have a relationship to the director or the employee? Nope, I don't have any relationship to them. Okay, so your profile is made. Okay, and then like the job that we searched, for example, senior medical officer, sorry, senior house officer. Okay, and search. You can actually here you can actually locate and tell the postcode of any particular place that you're searching for a job, but since this is your first job, so you cannot be very choosy and picky about it, so I'm just going to omit it. Okay, the senior house officer has to go up there. Then just search it. So I've got a couple of posts. I'm just going to do is date posted first, go to the last one, so we get the idea, which was, so I've got a couple of jobs here. We'll go to the third page and search for the job that I like. You can get a surgical job, medical job, whatever job that you like. I'm just going to go for the senior house officer job in emergency medicine. Just click in it and you get to the apply for jobs, and here is going to ask you, where did you see it? I saw it on this website. Do you have NHS experience? So a couple of times they will ask you NHS experiences for 2 years or something. So I'm just going to lie just to showcase. I do have GMC registration. I do confirm that whatever is written is right, and submit the application. Okay, so it's going to, you can actually choose a new template, a blank, or the last one saved, which I actually saved right now. So I'm just going to choose the profile that's saved and load it, load the information, and voila, everything that you just made is here. And then what you do is you just save and continue, keep clicking till the time you get to, and you can actually upload your CV if you want. If you don't want, that's absolutely fine, because certain jobs are different. Certain jobs they have got different requirements. So I'm just going to continue, save and continue. Have you done any convictions? No, I am not a criminal. Nope. Save and continue. Then there's a declaration. Save and, so if you have done everything right, you'll get a green tick. So it means no information is left. So I did not upload a CV, so that's fine. That's why there's not a green tick there. Submit the application. It's going to ask you, are you sure you want to submit? Blah blah blah. Yes, I'm sure. Yes, obviously this is not taking error because I did not upload a CV in the submitting information, but that's about it. So this is how you apply for a job on the NHS jobs.
So that was me talking you through the application process, and just to make it clear, I can totally understand it's a very tedious and time consuming process. At times you will lose hope, and you'll be just questioning yourself, am I just writing it down right? Am I doing something wrong? But to be honest, there are too many applications, so it may take some time to get yourself enlisted. But as you walk yourself through the journey, making your profile over and over again, just make some needed changes as you walk through in order to make sure that your profile is better day by day, and hopefully you'll be able to get an interview soon. And best of luck for everyone. If you like this video, please like, comment and share, and let me know what other video content you would like me to share with you people. Not that I'm an expert, but I'm just here to help my fellow doctors and colleagues and share my bit of experience, and that's about it. See you later. Bye bye.